So if you're up on this live video, thank you for joining us. And this is morning in New Zealand. Now, please give me a thumbs up, and as well as share this live video and leave some comment and say hello to me. Now, if you have any question, you can leave your comment down there, leave your question down there, right? And I'll come back here, and I'll after this video, then I'll give you an answer. I may miss your answer while I am doing the live video because I have different platform. I can't just focus on one or the other platform. Okay, just letting you know that. Okay, I'm going to my Facebook right now and try to share my live video, and I would like you to do the same with me, please. Let's go to live. So yep, here you go. I'm gonna do live share. So our topic today is acupressure point for stable angina. Okay. Hi Karuna, how are you? All right. So it's very early in the morning, isn't it, today? I think it's getting warmer here. I don't have to turn on the heater. Then this is actually warmer. Right. So we know the angina symptoms. Now we talk about acupuncture point strategy for angina. Now today is that was when we talk about acupuncture, that was for more for acupuncturists, right? But today we're going to focus on acupressure point. And acupressure point is for anyone. If you suffer from chest pain, angina, then this is for you. It's for acupuncturists or massage therapies. Now, if you have patients who suffer from angina, or you haven't had any come to your clinic yet, that's okay. Learn this, remember this, and this, then you will be able to show to your patient when a patient come to you that suffer from angina. All right. Hi Veronica, how are you? Good. So it is important though, because I use this point a lot. And hi Julia, how are you? So I actually show my patient to do that every day. I ask them to do it every day. Okay. Again, if you're following my video for a long time, then you know the first point that I'm going to show to you is where I just showed you yesterday for the acupuncture point. Is the Jogong Agua. So it's about 3 chun, 2 chun, okay, 3 fingers from here to here, right? Over here. Then again, your pain will be maybe in the middle, from the side, or to the side over here, right? There are a lot of meridian in here. Now, you don't need to know where exactly the meridian is, because where I'm going to show you, it's going to cover all here. Now, the question is, how do you get to the point that can help with the chest? If the pain in here, or if the pain in here, because they are on different meridian, right? But I told you that you don't have to memorize, because as a patient, you're not an acupuncturist, so you don't need to know. You only need to know which area, and you only need to find out the most sensitive one or the sensitive point. and give those sensitive point massage. That's it. So it's so simple, right? So 3 fingers from here, from the wrist. So on that level, you're gonna press from here toward over here, from here toward there. Press it in here on the side. This is actually lung meridian, but you don't need to know that. If that is painful or tenderness sensitive, keep pressing it and rub it like this. For how long? Okay, up to 1 minute. Then you move to the center and press it like this. Same thing. Okay. If there is no tenderness spot, keep moving to the next. Okay, so simple. Right. Then you move up a little bit, 1 level. Do the same from the side, middle to here. Okay, those are very important. Very important. If you have any pain in your chest, if you hit any sensitive point, you do it straight away. It'll give you relief of your chest pain, angina. And do 1 level down. So 3 finger, right? This level, up 1 level, lower 1 level, right? 2, 3. Okay, all those 3 levels. Right. Now, apart from here, remember I show you whenever it comes to chest pain, I show you this one. This is very important one. It's going to help you a lot. Right. Now, for those you have been following my video for a while, you know this already. Now, in Chinese medicines, in acupuncture, this is just one of the strategy we call protocol. There are many other protocol, right? So I'm going to show you something new that I haven't shown you before. I haven't shown you on the previous live video before. Okay, it's over here on the back. This point worked very well too. Okay, but it needs someone to work for you. Okay, so how it works is on the spine, right? 华佗夹击 point is about 0.5 tune next to the center of your upper back. Now you want to do from T1 to T10, right? Thoracic 1 to thoracic 10 on 华佗夹击 point. Now, it's difficult for you to do it yourself. If we can get someone to press on the spine here. Oh, here's the spine. Let me to go off a little bit. Here's the spine, the blue one, T1, T10 about here. Safe in general for chest pain, you need to do it over here. But just in case the chest pain actually from the stomach and spleen, so you go down to T10, right? So how do you do that? You can use a knuckle and go to right next to the spine, right? On here, and you press it. If there is, you press it and rub it. If there is any tenderness spot, give it about 3 seconds. Rub for 3 seconds and move down until you cover all this area on both sides. Right? So yes, you need someone to do it for you, and that's right. It will work very well. I tried in my clinic when my patient had pain and asked them to do that. I do that for them. Right? You can do it yourself by hop over to some tennis ball. Much more difficult on that one. So I know the first point that I show my patient is this one, chest pain. Right, I hope you learn it, and remember this: if you're an acupuncturist, show to your patient, right? And this one is you can show the family to help with that. So combine this one, it get rid of the chest pain much quicker, and it get rid of heal the angina much quicker. So your aim is get rid of all the sensitive point. Get rid of the sensitive point over here. Get rid of the sensitive point over here as well. Okay. I hope that makes sense to you. Okay. PC6 area give instant relief to any chest pain. Yes. Yes and no. Yes and no. PC6 area, if PC6 at just one point, right, it may not give relief to all the chest pain. But PC6 area at Jiugong, where I just show you, yes, it gave all relief across the chest pain. But one thing that it may not work well if the chest pain stay in the middle, and we need to use this. But it won't get to that if you do the DHA on the lung meridian. It will work for this one, but it sometimes doesn't work well. Then you need to use your scalp acupuncture or use the back one over here, and it'll help even better. To say case by case, every case is different, and when you do all this point, some of it you get instant relief, some of it you get relief, but the pain still there a little bit. Then I would recommend you do the back one. That's why I'm going to show you. That's why I show you two different acupressure point protocol today. Now, of course, you can do it on the opposite side as well. So keep it simple when it comes to acupressure point, because most of you, when you watch this video, you want to learn the acupressure point. You're not an acupuncturist. So keep it simple to show you two protocols. Of course, we have many other strategy of acupressure point that I can show you, but just keep it simple. I don't want to confuse you too much. And if you trying for those points and it helps, and my recommendation is go ahead to get an acupuncturist to treat you. When it helps you, which means you respond to acupuncture and you want to get rid of it quicker, you want to heal better completely, please go to an acupuncturist and get a proper diagnosis according to Chinese medicines. And you may need Chinese herbs. More importantly, you need to change your diet, lifestyle, and it will help even further and much quicker. Okay. Can you tell me where can I find the webinar for Juice until in Baihui? Okay, yeah. I don't serve a Juice Scale. It's about Baihui 12. The other day that I'll send it out. I haven't listened to my webinar yet, but I will list a link to my webinar and platform, so you guys can go log into my webinar platform and you'll be able to watch all this on my webinar platform, and I'll send out an email as well. I just haven't managed to do that. Okay, all right, that's it for today, and hope you guys enjoyed this topic today, and I'll see you tomorrow morning. See you then. Bye bye.